Well, thank you very much, Madam Chair, for allowing me to weigh in on this. And thank both of you, Governor Whitmer and Governor Pauls, for your participation here. As we roll out our economy, I think two of the most important things that we are going to have, first of all, we're going to have to combine technology that is robust testing along with personal responsibility, and that is following the guidelines that have been set forth by the coronavirus task force, washing your hands, practicing social distancing, etc. One of the things I want to remind you of is that pharmacists are the most accessible healthcare professionals in America. 90% of all Americans live within 5 miles of a pharmacy. Many members of the coronavirus task force have identified pharmacists as being critical in making sure that we get mass testing. And that's going to be very important. Admiral Gerard and um, Secretary Azar, CMS Administrator Verma have all identified pharmacists being key components of this. And I just wanted to ask you if you have experienced that in your state, Governor Whitmer. I've been to Michigan, and I know you have a very strong pharmacy association there. I've been very impressed with them, and wanted to know if you've experienced any of this, if you've utilized this, and what your thoughts are.
Yeah, thank you. I appreciate the spirit of the question and I agree with it. I think that one of the things that we've been able to do as we try to ramp up testing is to expand who can, write a prescription for a test or an order for a test. And we've included pharmacists, acknowledging that they are accessible and that people are very comfortable with their pharmacists. This is one important piece, I think, of utilizing all of the different strengths of a healthcare system that has been incredibly stressed, but recognizing where there are opportunities. And we work very closely with our pharmacists. I think that this is one place where this crisis has created a relationship that and an ability to confront the issue. And maybe there's more that we can do in that space.
Good. Governor Polis?
Yeah, we're look, pharmacies can be convenient, low cost, they're accessible. We're totally supportive of it. We're currently in partnerships. Kroger, Safeway, and Walgreens in Colorado are doing testing. We hope more. Anybody who wants to do that, we think that's a very convenient, low cost access point for people. So it's a great way to increase that collaboration with low cost pharmacists.
Have you experienced any federal barriers in the way of reimbursement or anything that you're aware of as far as it's related to pharmacists?
I'll ask our healthcare finance people, Congressman, and if we have some, we'll get that to you.
Not to our knowledge in Michigan. We've got great partnerships as just like in Colorado with our producing and conducting tests at pharmacies across Michigan. And so it's been working really well.
What about the drive-through testing? Have you had any of that in Michigan as well?
Yeah, we're doing a lot of drive-through testing. In fact, I went and did a drive-through COVID test as well as a serologic test. I maybe should have practiced before I did it because I made a funny face after that swab came out. But I think that it was so easy, so fast, and I'm really encouraging more people to do this. And I think that it's going to be really important that we demystify getting COVID tests and that we encourage people to do this. The more people that get tested, the more information we'll have as to how rampant COVID is and how we keep it from having to spread. And I also think early on, there were so few tests that we had to be very prescriptive in the few people that would get them. And now it's easier, and we need to all encourage people to get this testing done.
Good. Governor Polis, have you had the drive-through testing sites in Colorado as well?
Yeah, we were one of the first in the country to have drive-through testing 2 months ago. It's now a big part of what we're doing. In fact, at our largest single testing site at the Pepsi Center in Denver, which can see up to 1,000 people a day, it's actually a self-administered swab. So we no longer need the skilled professionals with the deep nasopharyngeal swab. There's two ways that we validated it. One is a saliva test. The other is they just roll it around like a Q-tip type item right at the base of the nose, self-administered, validated by our state lab, very easy, very scalable.
Well, I'm sure we won't agree on everything, but I do think we all agree that we all owe a great deal of debt to our healthcare professionals who truly have risked their own health in order to provide healthcare services for for others, for our citizens. And certainly I want to include the pharmacists in that as well. So thank you, Madam Chair, and I yield back.